But first tonight, Singapore has confirmed 47 new COVID-19 infections, and that number is more than double yesterday's record high of 23 new cases. There are now 313 infections in the country. Multi-Ministry Task Force Co-Chair Lawrence Wong says Singapore has to be mentally prepared for the number of cases to continue rising, and he's also announced new measures to curb the spread of the virus. Singaporeans are now advised to defer all travel, not just non-essential trips. Mr. Wong says this will reduce the risk of Singaporeans being infected abroad and not spreading it to others when they return. And all incoming travellers will be put on a 14-day stay-home notice starting just before midnight on Friday. That includes Singaporeans, permanent residents, long-term pass holders and short-term visitors. They will also have to provide proof of the place where they will serve the notice. 33 of the 47 new cases are imported. 30 are Singapore residents who were infected overseas. 19 had travelled to Europe, 6 to North America, and another 6 to ASEAN countries. One person visited other parts of Asia, and another was in both Europe and the US. 3 of the imported cases are visitors to Singapore. 9 are linked to previous cases, and 5 have no known links at the moment. These numbers and measures were just announced less than an hour ago, and our reporter Li Liang was at that media conference. So, Liang, what was the rationale for these additional measures, though?
Well, as we've seen over the past few days, the virus has been rapidly spreading around the globe. In fact, it is in over 100 countries right now. And the government is expecting more Singaporeans to be returning home. Now, they could be students who were studying overseas or on exchanges, or they could be people who were working overseas and now have decided to come home. Now, no matter what it is, there's a good possibility that some of these Singaporeans are infected with the have the COVID-19 infection. Now, in these measures, the 14-day stay-home notice for all Singaporeans returning home are to minimize the risk of the virus transmitting broadly within Singapore. Now, we've seen how, for example, in the Safra Jurong cluster, how it can spread quite fast and quite rapidly. Now, the government has also said that even people who have returned recently, maybe a few days or just before the Friday deadline, that they be socially responsible, and even though they are not required to serve the 14-day stay-home notice, they should self-isolate at home. Now, they also said that MOE will be announcing measures for students who have travelled during the March holidays, and that will be announced later.
Most of these cases are imported ones, and the majority are Singaporeans and residents coming back from overseas. We've said this before, and fortunately we have been able to pick them up early, some even right at the airport, some shortly after they come home and they see a doctor, and we know that these cases have not gone on to spread to other people. But we cannot afford to take further risk if the number of these imported cases continue to rise. And that's why we are imposing additional border controls and travel restrictions today.
Li Ying, Singapore now has 313 cases reported, and Mr. Wong, he just said that we should be expecting the number of cases to continue rising. How are the medical facilities coping or going to cope with an expected rise?
Well, the government has made plans to ensure that Singapore's healthcare system can cope with such a rise. Now, for example, Health Minister Gan Kim Yong said that he had visited Tan Tock Seng Hospital and NCID today, and the hospital has taken the minister through their plans as to how they would cope with if more cases come. Now, it could be that they could convert normal wards to isolation wards. Private hospitals could also take in non-COVID-19 cases, so the capacity is then freed up at public hospitals to take care of COVID-19 patients. Now, previously, the government has also said that there could be the possibility where milder cases of the COVID-19 infection are actually not admitted into the hospital and they could be treated within the community. Now, arrangements are currently underway to convert, for example, quarantine facilities or long-term care facilities to take in this kind of milder COVID-19 cases.
It's important for us to always bear in mind that while our healthcare capacity is sufficient, we have planned for it, but we should never be complacent and take it for granted. We must do all we can to manage the number of cases so that we aim to reduce the total number in any day, the peak number in any day, so that our healthcare capacity can still manage them, and also to delay this peak for as long as possible. And we do want to preserve as much buffer capacity as possible, so it is in our interest to ensure that we reduce it as much as possible and to defer it as long as possible. But by deferring the peak, it also may mean that the outbreak may last longer.
Li Ying, thank you very much for that update. That was Li Ying there with that update on the COVID-19 outbreak situation.